I want to come back now to our main story this hour. Calls for the military to intervene from Western Cape health authorities. Extra beds needed to address the number of new COVID-19 infections in the Western Cape. The province is already experiencing severe pressure and hospital admissions are expected to rise. Health authorities say the second wave numbers are proving to be higher than in June, with deaths increasing sharply over the past 4 weeks.
Coronavirus infections are tearing through the Western Cape, showing no signs of letting up. The province now has the highest number of active cases, with over 38,000 infections. Officials are scrambling to create additional hospital space. But the hard truth is, with over 800 staffers out of service due to infection and unprecedented hospital pressures, morale is waning among those working in the COVID-19 trenches this Christmas. Natalie Melchas has more.
From the whimsical flower-inspired names of the Four Wings and Freezy Award, there's nothing light about battling the pandemic here. And health workers are burnt out. They'll probably also spend Christmas on call in the COVID wards.
The first time around we were really motivated. We're still motivated, but we are tired. We're tired. We have too few doctors, and it's very stressful. And I think I can safely say that for most doctors at the moment. I think, at the end of the year, sometimes we're so used to things winding down and being able to relax a little. And none of us have been able to do that.
Some staffers at the Mitchells Plain Hospital were also deployed to the CTICC Field Hospital during the first surge. They recall many successes in the Hospital of Hope, but admit they're overwhelmed by the effects of an aggressive mutant killer virus behind the second wave.
It's difficult this time around, and it's difficult. I mean, patients are coming in constantly, patients are leaving constantly, and unfortunately patients are demising also all the time, and it's difficult. I think that has been one of the most challenging things, I think, for the staff. I think we all know what we're here for, but at this level has just been difficult for all of us to manage.
The sustained period of extreme demand has already stretched the health system to its brink, and the anticipated peak is still some 3 weeks away. Natalie Melchas, Cape Town.
The deaths when coming to COVID, they are more than under normal circumstances. And it's something that's really even tearing us apart, because we also put ourselves in those families.
Basically, being a doctor during a pandemic obviously is very stressful. Basically, because we don't really know much about the COVID-19. So we know corona, but we don't know much about COVID-19.
Despite the challenges, healthcare workers continue to risk life and limb.
It's a very stressful situation because the high care has a lot more critical patients requiring care. We are a specialized oxygenation unit. So when someone has lung damage from the coronavirus, they don't get the oxygen through their lungs into their body.
Initially, it was quite challenging with the amount of ventilators that we had, but we had to set up a criteria for patients, and we had to, come to a point where we ethically choose the patients that we thought would survive adequately once intubated.
I've been talking to Santa, and we don't know what to do. I've been crying, I've been dying, here thinking of you. It's another Jimmy Ginger Christmas for me.